Hello, I'm Julie Ishida from the University of California, San Francisco, and the San Francisco VA Medical Center. This is a CJSON podcast that will discuss our study about the association between marijuana use and kidney function in young adults. In the United States, legalization and acceptance of marijuana have become more common. Previous research has shown associations between marijuana use and adverse psychosocial, cognitive, and respiratory outcomes, but we know little about its impact on kidney function. Some animal studies suggest that marijuana could cause kidney damage, whereas others suggest that it could improve kidney health. So while it is possible that marijuana could affect kidney function, data in humans are limited to reports of individual cases of acute kidney injury from the use of synthetic cannabinoids, or single-center studies with few individuals followed for a relatively short time. Hence, it is important to determine the effect of marijuana use on kidney health. We used data from the Coronary Artery Risk Development in Young Adults, or CARDIA study, of 3,765 participants with normal kidney function at baseline, defined by an eGFR greater than 60 milliliters per minute. The participants had a mean age of 35 years. Past or current marijuana use was reported by 83%, and the mean eGFR was 111 milliliters per minute. We first evaluated the cross-sectional association between marijuana use and eGFR and found a modest association between higher marijuana use and lower eGFR. We then studied the longitudinal association between marijuana use and change in kidney function over 10 years of follow-up and prevalent albuminuria over 15 years of follow-up. In this analysis, we did not detect a longitudinal association between marijuana use and change in kidney function or prevalent albuminuria. Our study was observational and hence, care should be exercised in interpreting the study results. Additionally, our cohort consisted of young adults with normal kidney function, so our results are not generalizable to older adults or patients with CKD. And although most participants had previously used marijuana, heavy use was uncommon in this cohort. Strengths of our study were the large sample size, long duration of follow-up, and repeated assessments of marijuana use in kidney function. In summary, we found no evidence of a benefit or significant risk of marijuana use on kidney function. It is possible that the associations could be different in other settings, such as older adults or kidney disease patients. Given that patients with greater marijuana use had lower kidney function at baseline, we believe that further studies in other populations are warranted. I would like to acknowledge that our data were supplied by the CARDIA study and that this work was supported by grants from the NIDDK. Thank you for listening to the CJSON podcast.
This podcast is copyrighted by the American Society of Nephrology, all rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare provider if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast of the American Society of Nephrology.